Okay, so this is chapter 16, general pharmacology. So we'll talk about what medications we carry on the ambulance and that you can administer. We'll talk about all the things you need to think about before you start giving medications to patients. We'll talk about how medical direction plays into all this and how you can assist with other providers that are doing IV therapy. Okay, so what medications can you administer? You can administer aspirin, oral glucose, oxygen, activated charcoal, although this is one that's not in our protocols currently. Bronchodilators in the inhaled form. So this is your albuterol inhaler basically for asthma. Also patients with emphysema and chronic bronchitis. The action of this medication, what it does is it expands the breathing tubes. It also tends to increase the patient's heart rate. Sometimes makes them feel a little jittery. Because of that increased heart rate, their heart needs a little bit more oxygen itself. We can also administer nitroglycerin. Most of the time it's going to be in a sublingual spray or tablet, not the inhaled form here. Nitroglycerin is prescribed to patients when they've had a history of heart attacks or other cardiac issues. And so what nitroglycerin does is it dilates coronary arteries, vessels. So if you're getting a little bit of blockage in one of those coronary arteries that feeds your heart muscle, then the nitro will expand it a little bit, let a little more blood flow through. Contraindications for this one are fairly important. So this is one of the medications that if you give it wrong and don't check these contraindications, you can do some fairly potential for pretty good harm to the patient here. So contraindications are low blood pressure. So our protocols say they got to have at least 90 to 100 systolic. And the reason is that the nitroglycerin, besides dilating coronary arteries, dilates other arteries in general a little bit and vessels, and so it lowers blood pressure. And if the patient is taking any medications for erectile dysfunction, your Viagra, Levitra, Cialis, etc., that can potentially interact with the nitro and cause a really serious drop in blood pressure. So again, it's a general vasodilator, and the side effect is dropping blood pressure. We can also give epinephrine in auto-injector form, and here in Idaho you can also give it drawn up in a syringe and injected directly subcutaneously or intramuscular. And the reason we went with that IM route, and that's an optional module here in Idaho that we'll cover, it's basically because the price of those EpiPens got pretty outrageous. up to several $100s a pen, and a little vial of epi costs like $5. So just decided to train people up to be able to give it from a little vial. So epinephrine is used for severe allergic reactions, specifically anaphylaxis. We'll talk more about that in its own chapter. What epinephrine does, it's a vasoconstrictor, so it's going to contract your vessels, blood vessels. It also is a bronchodilator, so it's going to open up the airway a bit. Side effects here are increased heart rate and increased blood pressure. Okay, and we'll talk more about each of these specific medications down the line. It's just kind of the introduction. Okay, so general information about medications. So each drug has both a generic name that we tend to use when we're talking about stuff, but it's also got a chemical name and a brand name. So, like ibuprofen would be a generic name, and Advil a brand name. Chemical names we usually don't even bother with because they're complicated and we just don't need that kind of detail. So before you start giving a medication, you think about these things. So one, the indications. So this is signs and symptoms that would lead you to give that drug. So for like oxygen, indications would be breathing difficulty and SpO2 less than 100. Contraindications would be when you would, things that would make you not give that medication when you otherwise would. So in the case of like the nitroglycerin, somebody having chest pain, severe chest pain, and prescribed the nitro, that would be somebody you would give the nitroglycerin to, but a contraindication is the low blood pressure. So if they had blood pressure below like 100 systolic, that would be a contraindication. Side effects are kind of the predictable effects of the medication that you can see coming. Versus your untoward effects, which are the less predictable ones. Whenever you're giving somebody any kind of prescription or drug, just remember that these things have sometimes lots of weird effects, so make sure you know what you're doing, make sure you know the medication, and you can't get yourself in too terrible much trouble with the medications allowed, but nitroglycerin you gotta be pretty careful with. Again, use good judgment. So, giving out medications can be authorized a couple ways. So one is offline, where the use of that medication is in your protocols and you don't need to call to get use authorization for any particular time you want to give it. Versus the online medical direction. So some medications in some jurisdictions you need to call for medical control before you give that medication each and every time. So under our protocols here in Moscow, all the medications that you can give as an EMT are all offline. So they're just within our protocols, and you can give these medications without specifically calling for medical direction. Back in Colorado, for example, it was a little different. We had to call if we wanted to give ibuprofen or nitro. So it's going to be one of those things that's specific to your protocols and your medical director, whoever that happens to be. So if you're calling for online medical control, you'll call the ER number and ask to talk to a doctor and describe your patient signs, symptoms, tell them you want to give whatever med, and get the okay basically, and give as directed. We want to check the 5 medication rights whenever we give a drug. Do we have the right patient? So are they exhibiting signs and symptoms? Is it the right time? Is the medication not expired? Is this the actual medication you think it is? So there's other things that come in, like inhalers. Make sure that just because it's an inhaler, it's not some inhaler for some other random thing. So check that. And we start talking about medications in bags of fluid. Those all look pretty much exactly the same. You gotta be careful about picking the right bag of fluid out. Things that come in vials, just be careful. Make sure you're grabbing the right bottle of stuff. Make sure you're giving the right dose. Right, misspelled there. Look at that. And then the right route. So we'll talk about the routes, but some things are oral, some things are sublingual, some things are inhaled, some things are injected. So by the right route. This is another good list of things to memorize. It's especially easy to write quiz questions about this kind of things. Okay, so some different routes. Oral or swallowed, so like whatever pill you take, ibuprofen, Tylenol, whatever, most of those are oral. Sublingual, where you put it under your tongue and let it dissolve. So this is the way we're going to give nitroglycerin versus your inhaled. So that could be like your albuterol inhalers or nebulized stuff as well. Intravenous, so injected into a vein, versus intramuscular, injected into muscle. Subcutaneous, which is pretty similar to intramuscular, but just injected under the skin instead of into a big muscle. Intraosseous, that would be injected into a bone cavity. Intraosseous, we can usually interchange with intravenous, so anything you can give intravenous, you can usually give intraosseous. And believe it or not, sometimes it's easier to establish an intraosseous line, so put a needle into somebody's bone, than it is to do this. Intravenous. And then some things can be endotracheal. So this would be if a paramedic has your patient intubated, you can give some medications right down the ET tube and have it be absorbed through their lungs. Questions on those? So realize that depending on age and weight and metabolism, things like that, medications are going to affect people differently, right? So your younger, chubbier person is going to take up medications differently than your older, skinnier person. All of our medications are not, we don't adjust for patient weight. They're all just a given dose, but realize that it might affect the patient slightly differently. So anytime we give a medication, we need to document that thoroughly. So both the signs, symptoms, why we gave the medication, and then what we gave and the dose and the route, and then reassess after to figure out whether it worked, whether it did do any good for them. So you're going to encounter a lot of patients. They're going to take a lot of medications. So let's talk about that some. I'll get the whiteboard going.
That's what I was thinking. I think it's that. I can't tell.
I have no idea. A name would be good, and you guys don't know any prescription medications.
How are you?
So the name of the medication, why you would take that thing, what you might be worried about taking it, or
It regulates blood sugar, regulates glucose levels, and helps glucose to go into the blood, and not in the blood, in the cells.
Processed glucose. If you want to go vague.
It's 2 hours.
It's over the counter, but it's very expensive.
And another 2 hours. It's pretty
I'll just buy on some of it's supposed to be done. I guess it's already
prescription.
Actually, you can get prescribed.
Right. I have gotten some good stuff.
You can get
The most valuable
Yeah. My boyfriend didn't take that for a while when he was elderly.
I've done it.
prescribed.
Good effects. What am I saying? In cross country and track, we just had a bottle, like 1 person at a time had a bottle, like 600 ml, and we'd go through it in a season.
Antibiotics are prescribed.
Two.
I don't know if it's common to have
Okay, so other things that people take that aren't necessarily regulated by FDA, things like herbal agents, vitamins, this kind of stuff. So it's not that they don't do anything, it's just they're not regulated by FDA and haven't gone through a lot of rigorous scientific controlled, double-blind kind of studies, and so their effects are less well known and characterized. It doesn't mean they don't have effects. So this is just kind of a smattering of herbal agents that you can take for various things. When you ask patients what medications they're taking, you write down all the prescription ones, and it's not a bad idea to write these kind of things down too if they say they're taking supplements for whatever, because again, it's not like they don't do anything. If you take them in excess and stuff, they can certainly have effects, good or bad. Okay, real quick, kind of assisting in IV therapy. So as EMT providers in Idaho, you can't do IVs and stuff. You're not allowed to do this kind of thing without an optional module, which we offer approximately every year-ish once you've been on the department and gone on a few calls and kind of are comfortable practicing at the level that you're at a regular EMT level, and we can offer this optional module, and you can do IV access and stuff. The reason we kind of wait to get you into this is because once you know how to start IVs, everybody starts looking like a pincushion, and so some other things can be neglected. So the way we administer IV fluids, you can either do what's called a heparin or a saline lock. So this is a little plastic catheter that's threaded into the vein, and then there's just either a small tube or just a little cap on it, and you inject a little bit of saline in there to keep the little plastic catheter free and clear of blood inside the vein. But it's IV access, but it's just a little thing right there on their skin, basically. Versus a traditional IV bag where they've got the same catheter sitting in their vein, but there's tubing going up to a bag of fluid, and that's kind of constantly flowing fluids in. So at the lock style, you can come back and access that thing and give whatever medication you want through the port, but it's not constantly dripping in.
So like for cancer patients and stuff like that, when they leave and come back.
So that's a little different. Those are central lines, like PICC
Okay.
lines and stuff, the ones that are left in long term, yeah.
Do you use a heparin lock very often in EMS?
We don't. We usually just use saline. Yeah. This is one of those things that's kind of changed over the years. Back in Colorado, we did heparin locks, and heparin is an anticoagulant. So the idea is just keeps that little catheter in their vein from clotting off. But basically, decided that saline works just about as well, especially for the pre-hospital setting. So if we don't need to give them heparin, we don't anymore. We give them just saline. But it was always a fairly small amount of heparin in that solution that you injected anyway. So again, fluid administration sets. So this is the tubing and bag type of deal. So it's got a drip chamber, a little wheel clamp thingy that you use to regulate the flow, ports on the little tubing so that you can administer medications through it. Sometimes there's extension sets, so just more tubing all connected in line. And this is what one of those little bags looks like. And this is the most common thing we're going to hang a bag of, which is normal saline solution. So your blood isn't just pure water as far as its salt content goes. And if you give just pure water, you would mess up the electrolyte balance in the blood. So we give this 0.9% sodium chloride injection because that matches your blood's saline level. So to set this thing up, the bags don't come with tubing attached, so you gotta put the tubing in there. So you pull a little cap off, stick it up into the bag, adjust your flow rate. This is the little clamp thing that clamps off the tubing. This is the puncturing of the bag step. The big thing if you're doing this is just that end of that thing has to stay sterile. So these bags come in an outer bag and that's all sterile. This stuff comes in another bag and is all sterile. Anything that gets on to that little needle is going to get injected directly into their blood, which is bad if there's anything on there. So sterility is quite important with these things. So you puncture the bottom little seal there, fill that drip chamber just by giving it a squeeze. Roll that little dial open so that the fluid gets all the way through the tubing. You don't really want to inject a big old air embolus into somebody. Unlike you see in movies, a fair bit of air actually isn't going to kill anybody, but a lot of air could, so you want that tubing to be clear. Then you lock off this little thing so that when somebody goes to hook up the IV, it doesn't spray water everywhere. Yeah, at some point I'll get out the actual materials here and let you guys poke at it. Things that can go wrong, usually it's tubing is kinked or the there's a clamp on somewhere. Especially with kids and smaller patients, you want to watch the flow rates on these things. If you see a bag that's just drip, 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 dripping into somebody, you might mention that to whoever started the IV, because it probably shouldn't be just running fluid wide open into somebody. There's only a few cases where we want to do that pre-hospital. And then as you're caring for that patient, watch for infiltration. So the IV catheter is supposed to go right into the vein and stay right in there. If for whatever reason the person that was doing it didn't quite do it right, or it pops out, that little catheter can be just in the skin somewhere and you'll get just a little fluid bubble building up there. That's what infiltration is fluid making a little puddle basically under the skin where it's not supposed to be. Any questions on that? So again, your role in IV therapy is just to help the person out that's doing it. So it's the whole process can take several minutes, and we usually do it en route to the hospital, which our transport times are a few minutes. So if you can help somebody get all this stuff prepped, it goes better.